This medication is prescribed to alleviate pain resulting from nerve damage caused by diabetes or shingles infection. Before taking Pregabalin, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily after an evening meal. Swallow the tablets whole, and do not split, crush, or chew them. The dosage is based on your medical condition and response to treatment, so follow your doctor's instructions carefully. Use this medication regularly at the same time each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. Also, this medication may sometimes cause addiction, especially if you have a substance use disorder. Make sure to take this medication exactly as prescribed to lower the risk of addiction. And as always, tell your doctor if your condition lasts or gets worse. Common side effects of Pregabalin ER 82.5 mg tablet may include drowsiness, dizziness, headache, dry mouth, nausea, constipation, and weight gain. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. Remember, your doctor has prescribed this medication because they have deemed that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. However, seek medical help if you experience any serious side effects, such as vision changes, unusual bleeding or bruising, muscle pain or weakness, swelling hands/ankles/feet, or if you notice any unusual changes in your mood, thoughts, or behavior. In the case of very serious side effects, such as slow/shallow breathing or signs of a serious allergic reaction, seek immediate medical attention. This is not a complete list of possible side effects, so if you notice any other effects not listed here, contact your doctor or pharmacist. Before taking Pregabalin, it's important to let your doctor or pharmacist know if you have any allergies, as this medication may contain ingredients that could cause allergic reactions. Make sure to talk to your pharmacist for more details. It's also important to share your medical history with your doctor or pharmacist, especially if you have a history of heart problems, kidney disease, allergic reactions, substance use disorder, or breathing problems. This medication may cause dizziness, drowsiness, or blurred vision, and using alcohol or marijuana can make these effects worse. It's important to avoid driving or using machinery until you can do so safely, and to avoid alcoholic beverages. If you are using marijuana, make sure to talk to your doctor. Before having surgery, make sure to inform your doctor or dentist about all the medications and products you are using. If you are an older adult, you may be more sensitive to the side effects of this medication, especially slow or shallow breathing. If you are pregnant, it's important to use this medication only when clearly needed, as it may harm an unborn baby. Make sure to discuss the risks and benefits with your doctor. This drug also passes into breast milk, so make sure to consult your doctor before breastfeeding. It's important to be aware of potential interactions with other medications. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with this drug is orlistat. Taking this medication with other products that may cause drowsiness or breathing problems can increase the risk of serious side effects. Be sure to inform your doctor or pharmacist if you are using other products such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If you have any questions, ask your pharmacist about using those products safely. If someone takes too much Pregabalin ER 82.5 mg tablet and has severe symptoms like fainting or difficulty breathing, they should call 911 or a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with others, as it's against the law. Your doctor may also want to do some lab and/or medical tests, such as checking your kidney function and platelet count while you are taking this medication. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Pregabalin ER 82.5 mg tablet, extended release 24 hours anticonvulsants, Gaba-Derivative-Type. Here's what to do. If you remember before bedtime, take it after a snack before bedtime. If you remember the next morning, take the dose after the morning meal. If you remember after that, skip the missed dose and take your next dose at the regular time. Do not take 2 doses at once to make up for the missed one. It's important to store Pregabalin Air 82.5 mg tablet at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When you no longer need the medication or it reaches its expiration date, make sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. It's best to consult with your pharmacist or local waste disposal company for the proper way to dispose of the medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.